My name's Daniel and I'm the founder of Leap Healthcare and the primary physiotherapist here. I have been an athlete, a 400-metre runner on the track, and I got into physio because of my background in the health industry. I've been a personal trainer, manager of gyms my whole life, and I started Leap because I saw a need for change in the physiotherapy world. We very much focus on the reduction and removal in pain, and that's ultimately not what somebody is coming in for. They want to get back to sport, or they want to get a better quality of life, and just reducing their pain doesn't necessarily do that. So at Leap, we prevent pain, reduce the risk of re-injury, and ultimately help that person achieve an optimal quality of life. When patients at Leap Healthcare come in, we want them to experience a collaboration in creating a treatment plan and ultimately treating their injury. So it's not just about your practitioner telling you what to do and how to get your injury better. We treat a range of clients, from working with businesses to treat work cover patients, to everyday mums and dads, right down to adolescents and kids playing sport, and weekend warriors who just want to get better at their sport or get better at reducing their risk of injury. The studio has been set up purely for exercise-based rehab. Exercise is very important in a person's recovery because it's the gold standard of treatment for injury, and it always will be. So we focus on strength training, we focus on control training, we focus on correcting movement, and you need to have appropriate equipment to do that, and that's why we've invested the time and the money to set the clinic up the way that it's been set up. We use evidence-based practice as the cornerstone for the treatment of injuries at our practice, and that means using scientifically proven methods that we know are safe and effective. When you come in with an injury, you don't just go back to the level of function you had when you first came in. You actually leave stronger and better off than when you came in pre-injury. There are certain patients who come in who have tried all types of treatment. They've seen particular specialists. They come in and ultimately have lost all hope. And when you can get someone like that back to playing sport or back to even exercising, I think that's a really motivating thing. If you've suffered from injury and you want to return to work, return to sport, or return to your life-based goal, then you can get in touch with us for an initial consultation where we'll go through a thorough, comprehensive assessment and come up with an individualised treatment plan so that ultimately you can be stronger for life.